Hi, this is Dr. Juan Lopez from Dental Health Solutions. Thank you very much for clicking on the link of frequently asked questions during this COVID-19 crisis. One of the most common questions I get, especially as we are nearing phased reopening, is when can I schedule my dental appointment? If you heard my previous presentation, you know that risk levels among medical professions will vary. We do know it is an airborne disease, but it doesn't matter which list we look at. Dental profession occupies 3 of the first 5 professions at higher risk, with dental hygienists being the number 1, dental assistants being number 2, and general dentists being number 3. As you can see in the picture there, because of the proximity of the patient and the provider during dental care, we are at risk of aerosols from breathing, coughing, or even anything that's produced by our own dental instruments. Anytime aerosols are produced, the COVID-19 virus can then occupy the airspace, affecting the providers. So imagine the following. Dentistry has been playing a game, let's say basketball, for many years. We're very familiar with this game. And this is me, by the way. And all of a sudden, in the middle of the game, everything stops. And you're told that now you're going to be playing croquet. This will be very confusing. Not understanding at all what the new rules are, we must take responsibility and learn the new game. And this is what's happening. The government, regulatory agencies, health departments, and the CDC are asking us to create a new normal where we take under consideration our employees' and customer safety. We watch for gathering size and social distancing. We protect vulnerable populations. We protect the mental health and wellness of the individuals. And we determine what would be the proper personal protective equipment. Because restrictions may be lifted during phased reopening, but that does not mean that we're able to resume operations instantaneously. Right now, in a very condensed version, we have a very aggressive agenda. We're determining what new types of personal protective equipment we need. We also need to install new equipment that provide for better aerosol control within the building. We need to change the scheduling policies to observe social distancing and avoid overcrowding. We need to train staff on the new infection control protocols called airborne pathogen precautions. When we're talking about social distancing, which we are now very familiar with, we understand that appointments will be managed to allow for social distancing between patients. We also know that there's the need for social distancing reduces the amount of patients we can schedule per day. We are working hard to find ways to reschedule the hundreds of patients whose dental care has been interrupted. Also, if you didn't know, for your own information, personal protective equipment is in short supply. For example, the respirator called N95 for medical use, seen in this illustration, is completely in back order and will become one of the standards of care for dentistry. Supply levels of the necessary protective equipment is not expected to normalize until late June to early August. We need to secure this protective equipment in order to begin delivering care. This shortage will affect how and when we can resume operations. We have to understand that safety of our patients and staff is our number 1 priority. We are eager to see our patients and take care of your dental needs, but we must do so in a safe and responsible manner. Like many other aspects of life, we will have a new normal in dentistry that we will have to adapt to. You will hear from us when we're ready to resume non-emergency dental treatment. Thanks for your attention, and as always, stay safe.